Joining us for this week's Your Health segment is Dr. Syed Hasan, Associate Professor of Orthopedics at the University of Maryland School of Medicine and orthopedic surgeon at the University of Maryland Medical Center and the University of Maryland Rehabilitation and Orthopedic Institute. Doctor, thank you for being with us. You specialize in elbows. I've been watching a lot of sports on TV. Wimbledon, there was a golf tournament, a lot of baseball, a lot of things that put strain on elbows. But it's not just athletes who have problems.
Yeah, absolutely. I mean, so there's a wide spectrum of injuries that can affect the elbow. And as you alluded to, in fact, the most common thing we see, very common, is injuries, overuse injuries to the elbow. Classic tennis elbow, golfer's elbow. But, we see that not just in athletes, not just in tennis players, not just in pitchers, but in people, for example, who are plumbers, carpenters, butchers, anybody who really does an activity that puts a significant repetitive force on the forearm muscles can get an injury to the elbow, very commonly.
What's the weak link in terms of the structure of the elbow?
Well, so it's typically, what happens is the muscles on the top of the arm are the ones that raise your wrist and involved in gripping activities. And so that where that muscle attaches to the elbow bone on the outside, one of the tendons there can get these micro tears, micro trauma, which then causes pain and limitation of function.
Do you feel it? Where do you feel that?
Right. So typically people will come in and they'll say, my elbow hurts on the outside. They'll complain of the pain going down into the top of their forearm. Typically doesn't go into the hands and fingers. And if it is from a tendon problem or a muscle problem, that is, then it's typically not going to have numbness and tingling specifically in the hands and fingers. So it's outside elbow pain down to the top of the forearm. And if it's the tendons on the inside, it's sort of the opposite.
What's the escalation of treatment or therapies that you advise?
Well, so the best treatment is in some ways the hardest treatment because it's to stop what's aggravating it, which is not always easy, right? You say you got to stop doing what you love to do, right? And people don't necessarily want to do that. So rest is a big component of it. Then we can do simple things such as anti-inflammatory medication. We can do some splinting, bracing, a tennis elbow strap, which is basically a strap that goes on the forearm about here. Not too tight, slightly snug. Idea being that it takes the force off the injured tendon and allows that tendon to heal. Injections can work. So cortisone injections have a role, maybe not right away, but they have a role. And then therapy can be very helpful to stretch the muscles and tendons and also strengthen some of the other muscles around the injured one, to unload it.
How often do you do surgery for something like this?
Not commonly. So for the most part, this can be very successfully treated non-operatively with the measures we just talked about. I would say out of all the patients I see with tennis elbow, less than 10%, maybe less than 5% go on to surgery.
When we hear about baseball pitchers commonly, or catchers in the Orioles case,
right, sure,
having Tommy John surgery, is that limited to professional athletes? Do real people get that?
Well, I mean, I think it can happen to any individual who's involved in high-level throwing sports. So certainly even high school kids, older high school kids, collegiate kids can get it. And it's really interesting because the ligament that the Tommy John surgery replaces is a ligament on the inside of the elbow. And if you look at every single pitch a pitcher throws, the force on that ligament actually exceeds the strength of the ligament. So theoretically, every single pitch that ligament should tear, right? But it doesn't because there's the muscles around it help support it and help unload it. But over time, in somebody who's been pitching for years, that ligament can get stretched out, it can get thinned out, and get tears, and sometimes progress to the point where you do a surgical reconstruction.
I've heard speculation that high school athletes, the high school pitcher, specializes too early, and that they do nothing but pitch. Where in the old days they might have played some different sports, played a little basketball, mixed it up a little bit, and that's leading to more elbow problems. Any truth to that?
Yeah, I think there probably is some truth to that. I mean, I think that certainly from when I was in high school, back then there wasn't this year-round playing like you alluded to, and I think the travel teams and constantly throwing. But at the same time, I think coaches nowadays and trainers are very cognizant of the demands on the elbow, and there are guidelines on how many pitches a athletes should be throwing based on their age, what type of pitches they should be throwing, So I think that information is out there and disseminated. And I think if those guidelines are followed, that decreases the risk of injury.
How does someone know, in just a few seconds,
Sure.
Whether they should see the neighborhood orthopedist or they need an elbow specialist?
Well, I think it depends on the duration of the symptoms, the severity of the symptoms. If you just start having some initial pain, for a day or two, or a short period of time, I think it's certainly reasonable to see a local orthopedist. I think if you start talking about doing a ligament reconstruction, that's when you probably want to see a specialist.
Dr. Ash Hasan of the University of Maryland. Doctor, thanks for coming by.
Thank you for having me.
Do appreciate it.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.